Hello, my name is Lauren. I'm going to be your nurse for today.
Hi, Lauren.
Hello, I'm just gonna wash my hands really quickly and then we're gonna get started.
Sounds good.
Okay, so I'm just gonna take a look at your wristband. Can I get your name and date of birth?
Sure, my name is Javier Perez. Date of birth is May 22nd, 1997.
Okay, perfect. All right, so tell me what brings you in today.
I got a little bit of stomach pain in the lower right abdomen. I do have gastritis, so, I'm thinking complications from that. Maybe just a little bit of discomfort there.
When did you find out you had the gastritis?
About 6 months ago. I went to see my primary with stomach pains. I was having issues holding down food. They referred me to a GI doctor. I got an endoscopy, and it just confirmed that I had acute gastritis.
Okay, so the endoscopy was 6 months ago?
Yeah, roughly 6 months ago.
Okay. Perfect. And any other with past medical history?
Yeah, I had surgery when I was a baby, a newborn, on a diaphragmatic hernia. I had a benign cyst removed from my neck.
Okay, benign, so no problems?
No problems at all.
Only one cyst?
Just one cyst.
Right side?
Right side.
Okay.
And that's about it for medical history.
Okay, so any problems breathing with the diet after the diaphragmatic
Yeah,
hernia?
a little
Because
bit
you were
of
so
issue.
young.
Yeah, it's a great question. Yes, a little bit of issues breathing, sinus-wise. Every so often, one of my nasal passages will get clogged up. So I'll have to breathe through either one, or I'll just breathe through my mouth, or I take put nose spray or something like that to help clear me up. Yeah.
Okay, so
Yeah.
sinuses, and then anything other than the sinuses, like trouble breathing or anything like that?
No, just the trouble breathing on those. Sometimes leads to trouble sleeping a little bit. If they're really acting up on me, I'll struggle to breathe out of my nose, and you have to breathe through your mouth, and that kind of
That's not fun.
it makes it tough to fall asleep.
Okay. Okay, so with the gastritis, have you been following a different diet? Have you?
Yeah, I've been really laying off like no spicy foods. I don't drink very often.
But you do drink still?
Very, very rarely. Only when I go out, and even then, it's not a whole lot.
Okay, but you still drink alcohol?
I do drink alcohol. Yes.
Okay.
Yes.
Okay. All right. Perfect. All right. So, anything else? Any past surgical history? Any other complaints?
No, just a little bit of stomach pain on the lower right.
Here
today.
or there?
Yeah. Today's been bugging me a little bit, but
Okay.
no, everything else stuff not as good.
Okay. All right. Awesome. So, we are just going to do a little assessment, a head-to-toe assessment.
Perfect.
Basically, ask you the questions. And how do you like to be addressed, by the way? Is Javier okay?
Javier's perfect.
Javier Perez.
Yes.
Okay. And you're a 26-year-old male.
26.
Perfect. Any allergies to any medications?
None that I know of. My dad's allergic to the sulfite products.
Okay.
I've never taken any, so I'm not too sure.
Okay, and you're not on any medications
I'm
right
not
now?
on any medications now.
Okay, perfect. Alrighty. And do you see a gastroenterologist?
Not with frequency, no. Just the one time.
Okay.
Yeah.
Okay. Alright, so we're going to do your head to toe assessment now, just to make sure that everything looks good. Alright. So I'm going to start with your vital signs. I'm just going to take your blood pressure. We're going to do your temperature, things like that.
Sounds
routine.
Good. Sounds good.
Okay. Put this on your arm here. Alright, I'm just gonna pump this up to 30. Alright, perfect. Just gonna take your temperature, open up. Your tongue, perfect. Close your mouth for me. Alright, great. I'm gonna attach a little thing on your fingers just to check your oxygen levels, and they are 98, which is great.
Awesome.
Perfect. Alright, so now I'm going to take a quick look at your head and your scalp just to make sure that there's no lesions, bumps, anything like that. And I'm going to feel around a little bit, okay?
Okay.
Alright, perfect. And go ahead and look straight for me. I'm going to take a look inside of your ears, make sure that there's no drainage. Take a look to the left. Perfect. Any pain when I press on your ear?
No.
Okay. I'm going take a look at your nose. No drainage there. And then open your mouth wide for me. Tonsils look great. Teeth are great. Stick your tongue out for me. Perfect. All right, can you raise your eyebrows? Yeah? I'm gonna press on your shoulders, try to pull up a little bit. Pull your shoulders up. Okay, perfect. All right. Now I'm gonna take a listen to your heart, okay?
Sounds good.
You can sit straight and just get comfy. Perfect. I'm gonna press on your neck a little bit just to check your carotid artery. Okay, and the other side. Definitely see your scar there. Your little scar looks okay.
Yeah.
Go ahead and sit up for me.
Sure.
Just gonna press on your neck. We're checking for your lymph nodes and towards the back. I'm gonna press on your trachea, which looks like it's right in the center, which is just what we want. I'm gonna go ahead and press on your spine a little bit. Any pain?
No.
Okay, great. I'm gonna do something called percussing. It's just a little tap just to make sure that your the sounds sound normal.
Mm-hmm.
And then I'm just gonna press on your chest just to make sure there's no bumps or masses. Go ahead and sit back for me. I just wanna look at your neck again. Turn to the other side. And the other side. I think you might still have some cyst in there. There are a few little bumps.
Okay. Worth looking into.
Definitely. Go ahead and sit up straight for me. I'm gonna listen to your lungs. Breathe in deep. Okay, now I'm gonna listen to the back. Breathe in deep. Okay. Just gonna feel your distal pulses. Okay. Now I'm gonna take a look at your abdomen, so go ahead and lay straight for me. I'm gonna lift your shirt up. Is that okay?
That's okay.
Okay. Alright, so just by taking a look, everything looks okay. You're not distended or anything like that. I definitely noticed your scar right here. I'm going to listen to your belly now.
Okay.
Alright, I'm gonna press down. Any pain here?
A little bit of discomfort
A
there.
little discomfort? Okay.
Yeah. There's fine. It's alright.
Okay.
There's okay too.
Okay. Alright, so no mass. It's just a little tender here.
Yeah, a little bit. Even here on the bottom too is a little bit tender.
Tender down here
Yeah, a
too?
little tender right there.
Like right here?
Yeah, on the lower side. A little
Okay.
tender.
Okay.
Doesn't feel.
But no pain if I don't press.
No pain if you don't press.
Okay, alright. Take your shirt down a little bit. Okay, go ahead and sit up for me. Alright. So I am going to test your strength and range of motion. So just
Sure.
put your arms out for me. Go ahead and push against me. Okay, now pull. Perfect. Go ahead and put your legs up here for me. Okay, I'm gonna push Okay, perfect. Pull. Great. Okay, put your feet back down. I'm just gonna take a quick look at your eyes as well and your mucous membranes just to make sure that everything looks nice and moist. Go ahead and look up for me. I'm gonna gently pull down on your eyelid, okay? Nice and pink and moist. Now I'm gonna check your eyes. Go ahead and look at the light. Okay, so we're just checking your perla just to make sure that your pupils react to the light, which they do. Sorry, I know that was bright. Okay, go ahead and stand up for me. Walk a little bit, like a few steps here.
With my eyes open or eyes closed?
You can do eyes open.
Okay.
Perfect. Turn around and walk back.
Turn around?
Walk back. Take a few steps backward. Perfect. Okay, you can come back to where you were. Turn around, still standing. Go ahead and close your eyes and keep your arms down to your side. Now lift them up. And to the side. I'm gonna press down. Good. Now push down. Good. All right, perfect. All right, have a seat for me. Okay, so do you know where you are?
Oh, yeah, Miami, Florida.
Okay, you know your name.
Yes.
Clearly.
Javier Perez, yes.
Okay, perfect. And your date of birth?
May 22nd, 1997.
Okay, perfect. Any like anxiety? Are you getting enough sleep at night?
About 6 to 8 hours. You know, some nights you sleep well, some nights maybe a little bit too few hours, but it's okay overall.
Okay, all right. Any like depression or anything
No,
like?
no, nothing like that.
Okay, you would say you're overall pretty like active, social.
Yeah, pretty all active, social.
You work out.
I go to the gym. Yes.
Perfect. Do you have family here?
I do have family here. Yeah, my family all lives in the city.
Okay.
Yeah.
All right. Awesome. Siblings?
Yeah, I have a little sister who's here, and I have my little brothers in college in UF.
Oh, okay.
Yeah.
All right. And your parents?
My dad lives down here. My mother's deceased.
What happened? I'm so sorry to hear that.
Thank you. She passed from melanoma. This was about 5 years ago.
Okay.
Yeah. Yeah.
Okay. And your dad?
He's good.
Healthy?
He's still kicking.
Okay.
He's out there, yeah.
Still kicking?
Still kicking. He's good.
Okay, perfect. All right. Okay, so I would recommend just from the breathing, if I'm having trouble sleeping, maybe you can go see an ENT. I know that sometimes they do, they can help you out, see what's going on. I know that some people are, I guess you could say candidates for surgery. I don't know if that would be you, but if it's something that's keeping you, because I think you mentioned before that you have trouble sleeping at night from that.
Yes, absolutely.
Okay, so that might help, and they could just further help you on, you know, how to manage that.
Sounds good.
For the gastritis, definitely stay away from any alcohol, fried foods, and overeating.
Okay.
That'll definitely help you.
Okay.
Try to stick to a healthy diet. Of course, you do work out, which is great. Not concerned there. And being that your mom did pass from that, I think getting your skin checked, definitely.
Sure.
Melanoma isn't known to always be, you know, get passed down, but it is just being that it is in the family, you know, just do your skin checks, I would say.
Absolutely.
Every 6 months or so, or go see a dermatologist.
Will do.
Okay, do you have any other concerns for me? Any
No.
questions?
Everything was
Need
great.
anything? No?
No, everything perfect sense.
Okay, perfect. Well, don't hesitate to reach out if you have any questions.
Will do.
I'm just gonna wash my hands. And it was so nice to meet
It
you.
was a pleasure meeting you.
Have a great day.
You as well.